All right, the second movement inside of the Keystone Reset program is actually going to address one half of the pelvis. So we like to think of the pelvis as a circle, and it really has no sides. Obviously, your body has a left and a right. But when we're talking about the pelvis, we think of it in terms of a circle because ultimately the same joints kind of go dysfunctional in the same ways over and over, but pain presents in different ways depending on who you are. A right-sided pelvis dysfunction can show up on the left side in terms of pain. And so we try not to attach these positions to any specific pain point, just because over and over and over again, we've seen that working these positions in the same way all the time always provides pain relief regardless of where that pain is. Okay, so a common question we get once we start launching into the program is, am I going to do this on the other side? And the answer is no. And the reason for that is we're trying to move specific joints in a very specific direction to achieve better symmetry in the body. So if we were to do one thing on the left and then do the same thing again on the right, what happens is you actually solve some dysfunction on one side, but then recreate the dysfunction when you flip it over. So the only thing that is different is you have to test your side glide, that very first thing we did. That's usually the only one that could go either way. This one and the next three after it are going to be exactly the same no matter what, no matter the pain point, and you're going to get a great result out of that. So what we're looking at is called a right upslip, and this is where the right half of the pelvis tends to get jammed upwards a little bit, and so it's very simple how we're going to solve this problem. Most people will do this on the bed at home, and simply you just lay on your side and you let the right leg hang off. Now you should get a very similar feel here if you did a right side glide, a stretch kind of over the top of the hip, and that's what you're looking for. Now, the anatomical components to this are the IT band attaches to the top of the pelvis right here, below the knee. The sacrum is actually on this slant right here, and so through those anatomical structures, time and gravity, it's actually going to allow the right half of the pelvis to start to sink back down a little bit, okay? So our side glide was a 5-minute stay. This one is also going to be a 5-minute stay, so just get in the position, get the moderate feel right on your side here, and then you're just going to hang out and relax for 5 minutes, all right? And once the time is up, just bring the knee up, and then you can sit up to the side, all right? What that's going to do is prevent any rebound stiffness from happening. If you fly out of these positions too quickly, you could get kind of a rebound stretch or kind of some rebound pain, especially if you're already a little bit tender. So just bring the knees up, come out slow, then we'll move to the next one. See you there.